The bane of the existence of the peripheral operator is calcium. Calcium, 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 that's probably number 1 through 5. And obviously, the sicker the patients are, the worse the disease is. No difference in a rusty pipe that's been neglected for 20, 30 years. Good luck. You can't cut an artery out and put a new one in. Technically, you can do bypasses, but it's very difficult to treat these concrete-like vessels. So the challenges become, with the lack of purpose-built equipment, how do you tackle these challenges? And that's why everybody's trying to create purpose-built innovation to deal with this problem. But having said that, there still is a major need for fundamental education because diabetes isn't going anywhere. It's actually a global pandemic in the form of diabetes. More amputations are actually happening despite all the awareness and advocacy against amputation in the form of amputation prevention and CLI awareness. So how are we going to tackle that? It's not with tackling the worst part of the disease. It's by preventing it up front and then addressing it with trained personnel. So where are these people coming from, if not coming to specialized meetings? So we need specialized training programs. We need to recognize that this is a different disease entity. Critical limb ischemia does not follow the logical progression that we want it to, like peripheral arterial disease. One day you're fine, the next day you've got cancer and you had no idea. So critical limb ischemia is very similar to that, and it requires special teams, special training. It really requires a grassroots effort to tackle this problem. Get a mentor. That's tip number 1 through 5. You have to start somewhere where you're comfortable being able to reach out to somebody, because as you start to develop your skill set, you're going to find yourself sometimes alone in difficult situations, and don't think you're too cavalier or too macho to reach out, he or she, to somebody who's been there, done it. You'll find that the CLI fighters community or these interventional guys, they're not just lesionologists, okay, treating just blockages. They treat patients and they want to help you get your program off the ground too. There's a camaraderie amongst the specialties. There's a camaraderie amongst these people that do the same thing you do. So find them in your community. I suggest that because they'll prevent you from going through a lot of the troubles that I went through. And why reinvent the wheel? So I don't like the word escalation. It sounds like you're going to DEFCON 1, from 5. What I like to think about it is playing billiards or playing pool. If I got my kids together, they're 7 and 9, and I ask them to play billiards, they're just going to whack at every ball, hoping it gets in. And if it gets in, they'll be happy. That's kind of how we start off doing angioplasty. If we cross, we're happy. But what if I put money on the table and said, now you had to play real billiards. You had to call your shots. That's angioplasty to me, where you shot select. You don't escalate. You go from one pocket to the next for a reason, with an intention. So if it's calcified, you're going to go straight to a supportive sharp wire. If it's mixed plaque and you need to do crossing techniques, you may choose some other piece of equipment. But to go through a logical progression that fits in a nice algorithm in a journal, that may waste time and money.